anything else? So he's not unconscious, and his left side is weak. So the first thing that doctors elicit is the chief complaint. So what brought you to the emergency room, or what did he say? Well, I'm going to go to next. What did he say? What did the patient say?
Oh, he was fine. He said, "I'm okay."
I'm okay. So we can't, but he can't stand up.
Yeah.
So what does that tell us?
Is he just in denial?
Well, denial means that he's denial of illness, or what else?
But later on it says that he's not aware of his own left arm.
And this is called what? Anosognosia. That's also the word for it. That's unawareness of illness.
What type of agnosia?
Anosognosia. A-N-O-S. Agnosia. You guys can keep that. Look at it. Remember that, Princess Queen Isabella.
Another thing, maybe the fact that he isn't registering any pain.
He's not registering pain, that's for sure. Go ahead.
Just in terms of anosognosia, how much relation does that have to something like a phenomenon like phantom limbs? Like what?
The phantom limb is something different. We'll talk about that. There's a cerebral interpretation of the peripheral stimuli, and it's always in the movie. The guy doesn't know that he's lost his leg, right? Because the brain, the sensory part of the brain, reconstructs the image and doesn't know that the limb isn't there. And most people who have an amputation have a phantom limb. What's bad is a painful limb, but that's part of the brain. You know, people who are blind don't see black. They often see things. If you ask them, they're continuously seeing things that they remember before they went blind. Or they see figures or flowers, or I remember one woman told me she saw the New York skyline at night. And the same thing, people who are stone deaf. One person had bilateral eighth nerve sections due to tumors, and he always heard a Dixieland band. And he said he didn't particularly care for Dixieland. That's what the brain shows so in the background. So the brain, there are central areas that are used to getting information. More common than the phantom limb is a chronic pain, and the brain learns. If you let pain become chronic, then the threshold for perception of the pain drops, and then the minor stimulus, or even if the stimulus disappears, then the brain keeps feeling pain. And so that's the genesis of chronic pain syndrome. But this is the opposite of phantom limb. This is unawareness. Okay, next. Go ahead. So, I want to say, so I made a point that he came with his parents, because at this point, the parents and the coach, you have to say what happened. And the same thing happens in the emergency room. If somebody comes in unconscious, you ask EMS, where did you find him or her? Were there bottles? Was it a street? Was it evidence of trauma? What happened? Because a person can't tell you. In this case, he can't tell us. So you have to make sure that you talk to the parents. And go ahead. And the past medical history obviously is partly from him and partly from them.
So it says he was negative for any previous medical or neurological problems. He did have one episode of syncope during blood drawing for routine tests.
But that's regular. That's anybody here fainted? Yeah. What were the circumstances?
I was getting a chickenpox shot.
Yeah.
Third grade, as a class we had to go over to the church, and it was really hot.
Yeah.
I cut my finger pretty thin, and there was just a lot of
Right. Yeah, I didn't faint, but that always happened to me, because somebody told me if you cut your lifeline, you die. Once when I was a kid, I cut this, and I said, oh, I'm going to die. Yeah, that's it. It's all the blood pools in the legs and the abdomen, and the heart becomes dry. There's nothing to there are different kinds of syncope. There's weightlifter syncope. You have to know how to breathe, because if you strain in Valsalva and do this, pressure in the chest goes up and no blood, either from the brain or blood from the legs, can get to the heart. And so this is called weightlifter syncope. And I think that this is a trick that guys use to make other people faint. You make them bear down and grab their chest and they faint. But that's the same thing. The heart becomes dry because blood can't get to it because of increase in chest pressure. Increase in chest pressure, that's why you get red in the face. And you'll faint if you hold your breath long enough. So syncope is usually a reflex, and it's the only thing about syncope is a person has to get flat. If the person doesn't get flat and faints with a dry heart, there's no blood getting to the brain, and if the patient's in the chair, they'll have a seizure. And that's happened to me twice, riding on planes, where you see people. There was a movie years ago, The Other Side of the Mountain, where a young woman who's a skier breaks her neck, and there's a horrendous fall, and then the next thing, you see her in a metal striker frame, and I rode on a plane twice when this movie showed, and people fainted both times. So what does the attendant do? She puts oxygen on the person, so the person starts to have a seizure. So you just grab them, throw them on the ground, and they wake right up. I could get a free drink. But that's it. They've got to get flat. If somebody faints at the table, old people do that. A few drinks, hot weather, a lot of food, all the blood pooling. They get up and they faint, and they say, "Well, sit down. You'll be all right." No, you got to get them out. Lie down. Get your legs up. Get the blood back to the heart. Okay, go ahead. More.
All right, so he denied any recent head or neck trauma. He had no prescribed medications and had no drug allergies. He denied the use
That's
of...
important. Drug allergies. You don't want to give him. You want to know something, and if you don't want to give him something that he's allergic to, you kill him. Go ahead.
He denied the use of tobacco, alcohol, or recreational drugs.
Do we believe him?
No.
That's why we put down, he denied, he alleges. Because, nobody will ever say anything in front of their parents, right? You always have to, take anybody in, a woman, a girl, and say, are you taking birth control pills? No sense asking emotionally charged stuff in front of somebody's parents. But, so that's what I couldn't deny. Go ahead.
He lifted weights, but denied the use of dietary supplements or androgenic steroids.
Androgenic steroids. Yeah, they're bad for you.
His parents and siblings were healthy, and there was no family history of neurological
Okay,
disease.
so this came out of the blue, as far as we know. What we worry about is, which doesn't seem to be relevant to this kid, intravenous drug users can have endocarditis, can have an infection of the heart valves because they're putting unsterile material in the bloodstream, and so they can have heart disease and feel clots from the heart. And people using cocaine. Cocaine raises the blood pressure, causes spasm of blood vessels, and you can have either hemorrhages or strokes. So it's very important to look for signs of either drug use, but usually people are very deteriorated, and or cocaine. But you have to ask in private, not in front of a man, not in front of his wife, and a young man, not in front of his children. Okay. And there's no, all right, let's go ahead. Physical examination. General.
A well-developed, muscular young man who is irritable but cooperative. Vital signs: blood pressure, pulse, respiratory rate, and temperature were normal.
So, usually an older person who has a stroke is hypertensive or has an arrhythmia, atrial fibrillation. So here, the blood pressure is normal. It could be up, and you're upset if you're in the emergency room. But and he doesn't have a fever, so he doesn't have endocarditis, and his pulse is normal, so we don't have to think of some kind of a heart arrhythmia, which young people can have, congenital heart disease. Go ahead.
Examination of the neck, heart, lungs, and abdomen were also normal.
Okay. And so what we do is, I'll tell you, the neck, you want to see he doesn't have, make sure he doesn't have meningitis. And we'd listen to his carotid arteries. Make sure he doesn't have a bruit, B-R-U-I-T, which indicates turbulence. You shouldn't. And we listen to his heart, the heart murmurs, and we listen to his lungs, and his abdomen is soft. So his general exam is normal. Go ahead. Mental status.
Alert. Oh, I'm sorry.
Okay. Mental status: alert and oriented to time, place, and person. Intact language, but he had difficulty reading from a magazine because he began in the middle of the line of print.
Okay. Let's just and read the next line.
Recent and remote memory were intact.
Okay. Now the way we check it is based on the mini mental status, which is a standardized form that we use to check to check all the areas: orientation, recall, attention, language, and basically it starts off with orientation. Like Connor, what's today's date? And what day of the week is it? And where are we? Oh yeah, what floor are we on? What borough? Yeah, so he's okay. Well, we'd ask you, and then we'd ask we check recent memory. I'm gonna say three things. Okay, you remember them: Red Table and Broadway. Say them to me.
Red Table and Broadway.
Okay, you remember them. I'm asking in a minute. Then we distract Will, so that he can't keep saying Red Table and Broadway, Red Table and Broadway. He's got to repeat Red Table and Broadway to make sure it registered. If somebody's confused or sleepy and they didn't get the words, then they won't remember it. We got to distract him. Spell world for me.
W-O-R-L-D.
Okay, spell it backwards.
D-L-R.
Okay. This is interesting. Our patient might not have been able to spell world backwards, because when you spell world backwards, you have to visualize it. And people who have dense left field cuts or left unawareness do D-L-R, and they leave the O-W off. They don't visualize the whole word. Yeah.
So when you visualize something, when you're thinking about a word, you can even be unaware of that left side of space, even in your own thoughts.
And you miss the word.
So is spatial analysis not something that has to do with the actual sensory input?
Yeah, I mean, well, there's two things. There's what's called the basic sensation, which is hot, cold, sharp, vibration, and then there's analysis, which is more position sense, and graphesthesia. For example, I'm going to draw a number with the palm of your hand and say, well, that's 1. Close your eyes. What's this? 3. Okay. So the brain had to analyze these squiggles, and I said, associate the squiggles with a number. So that's a cortical interpretation of stuff. The other thing is I'm going to put a coin in your hand. Close your eyes and tell me what this is. Yeah. So this is cortical sensation. Brain.
Cortical.
Yeah.
Or cortical.
Well,
Because you gave him a quarter.
Maybe you better do the rest of that mental status.